Hey, good evening, everybody. It's Nurse Eunice with Florida Training Academy, and in today's video, we're going to do a live session Q&A where you get to ask me anything. And so I'm going to give you about 10 seconds to get your notifications, and we'll get started in a few moments. Hello and welcome. As you join the live stream, let us know your name and where you are viewing from. Again, this is Nurse Eunice with Florida Training Academy, and we're going to be doing a live Q&A session where you can ask me questions and vice versa. And hi, Kelly, and hi, Karen. I'm doing good. You all, how are you? Hi, I'm blessed by the best from Atlanta. Absolutely. So we'll give, oh, it's a lot of you all. Hi, Lynn. Hi, Hopi. Kelly is from Missouri. And I don't want to mispronounce the first name. I think it's Abibuto. Michelle from Dominica. Awesome. So, everybody, what questions have you wanted to ask me? Normally, I have it more structured, but today I just wanted to make sure I took the time to answer whatever questions that you may have. Yeah, I'm happy to be back online, Karen. It's been a long few months, and I consider you like my extended family, so it's good to see you all. St. Pauline from New York. It's a lot of Juanita, Gerald, Gilbert, Happy from Florida, Esther, hi. So, um, and then Gilbert from Haiti, that is wonderful. What questions do you want to ask? Let's see, my favorite teacher, lecture streamer from Jamaica, my final year practical nursing student. Congratulations, Richard. And Michelle, we do not offer the LPN program. So what we do is unique, and only certain states are allowed to do so. In the state of Florida, you can challenge the CNA examination. So what we do is we have CNA exam prep. We literally prepare people for their exams. We also do NCLEX prep for the nursing programs. However, we're not a nursing school. So you can challenge in Florida the CNA program, but you cannot challenge nursing school. You have to get all your clinicals and do all your rotations. So we don't offer LPN, but if you let me know what state you're in, I will make sure that one of the next videos that I have, I'll do the research for you, or I can just message you offline and I can see the information as to some quality programs in your area, because not all nursing schools are the same. Whenever you're researching a nursing program, you want to look at those NCLEX pass rates, not just the price for the length of the program, because if they don't have high pass rates, that means that they're probably not supporting their students, and you probably won't pass that test on the first attempt. And so that's why I look at the pass rates when I'm determining which schools are best for nursing. Great question. Let me go back to see what I missed. All right, and so now looks like Karen has a question. It says, how do I know the difference between a Kennedy terminal ulcer from a pressure ulcer? And so what I would do, Karen, is that is something, because nurses don't diagnose. So nurses they would report what they see. And so if it's purplish, if it's discolored, if it has a smell, that's what we report to the nurse, to the doctor, and the doctor does the determination. And so I can't tell you how to spot the difference, because that sounds like something that more of a doctor would tell you. As nursing professionals, we just say pressure ulcer. I've not heard the term Kennedy terminal ulcer, but now that you've brought it up, I'm sure that I'll go online and I'll research it, and let you know more information. But if it's something so specific, that sounds like a doctor's diagnosis. Another great question. All right, so let's see here. Richard says, I'd like to know about the City and Guilds exam, if you have any idea. I don't, but I have a second computer right here. So you all have some very interesting questions. Now, Richard, is the City and Guilds exam, is that something native to a particular area? Um, And I'll look that up on my other computer, and I'll also look up the Kennedy terminal ulcer. And then we have Mr. and Mrs. Giddings from Philadelphia. Oh, thank you so much, Kelly, and good luck on your upcoming test. I'm from Georgia. You're doing a fantastic job. Thank you, Esther. Hi, Nurse Eunice. This is Paul from Qatar. I love you. I want to thank you for helping me pass my CNA exam. I'm so proud of you. And then Juanita says she passed her CNA exam in South Carolina. Now I moved to Florida. How can I get my Florida CNA license? So let me write down those first two questions. So we have the Kennedy terminal ulcer, which I'll research. And then I had another question from Richard about the City and Guilds exam. And while I'm researching those, I will answer your question about transferring your license to Florida. All right, so Juanita, now that you are a licensed, a certified nursing assistant in Florida, it's called reciprocity. And I will put the website in the chat area. You want to go to Florida's with the S on the end, nursing.gov. And that is for the Florida Board of Nursing. When you go to their website, you'll click on CNA or Certified Nursing Assistant. And then from there, you would check, you would look for reciprocity. And they will tell you the process of getting your license transferred from whatever state you are licensed in over to Florida. And I am afraid to share my screen because I feel like I may lose you all if I do. And I don't have anybody assisting me with this live stream. So let's see, a Kennedy terminal ulcer. All right, and so what it says here is that a Kennedy terminal ulcer is a skin wound that appears in some people during their final weeks of life. And it's not giving me much other information. Let's see, I'm on WebMD, and I'm going to put the link to this in the chat so that anybody who wants to know about Kennedy terminal ulcers will have a reliable source that they can go to. All right, so Richard, your question will be next. Let's see, I'm from Georgia. Paul from Qatar, I addressed that one. Yes, it should be on the ABE exam. Okay. Hello, those from Nigeria. All right, so what other questions do you all have? And if you don't have any questions, I have questions for you. What are some of the skills that are the most challenging for you, whether you're a CNA or a nurse? So we can create some videos to help you learn how to perform those skills. Thank you, Juanita. So I don't want to mispronounce your name, but the last name is Paul. You said it's your dream to come to Florida. Have you traveled here before? Have you looked into any travel nurse assignments or travel CNA assignments? I appreciate you all. All right, so my question was, what is the most challenging skills? What skills do you need assistance with? And I will put that in the chat. What skills are the most challenging? And that's whether you're a nurse or a CNA. So Richard, because you're in nursing, that the video on wounds actually would be a good video. I just have to be careful because we have a lot of CNA students and I need for them to stay within their scope of practice. So I think this is a good time for me to be asking you all this. Should I keep Florida Training Academy, this channel specific for CNAs, and then my other channel, which is Nurse Eunice, have that one more for nursing? What are your thoughts? So that'd be my second question, because I do need help because I don't want to be confusing people. There's so much to teach and that you all have so many different questions. But I'm afraid if I start putting, videos about wound care on this channel, we'll have CNAs trying to do wound care, and that's not within their scope of practice. So should I start a second channel specifically for my nursing videos. All right, can't wait to see what you all think. And while waiting for some of your responses, I will go ahead and let me look up the question that Richard had about the City and Guilds exam. Now, Richard, I am finding YouTube videos on it, but it seems that that is something that's not native to the US. So there's actually a cityandguilds.com website that I would recommend that you go to. Have you visited that website yet? And that's for the math skills. Oh, there we go. All right, so that's for Richard. And then Fatima, thank you. Yes, 2 different ones. So does anyone else agree? Yes, Kelly agrees also. I appreciate you all so much. All right, so let me go back. Vital signs, especially BP listening to the sounds. You know I already got a video for that, but it's on my other channel. So you all are making me tell on myself today. So I do have 2 channels. And my other channel is Nurse Eunice. And I will go ahead and tag that video right now that talks about the blood pressures and how to listen to the sounds. And also how to read the gauge, because I find that a lot of students don't give accurate blood pressure readings because they don't know how to read the devices. So for you all who need a video on blood pressure measurement, I have 2 videos on my other channel, and I just posted 1 there. And then communicating with a dementia patient. Oh my, I am blessed by the best. That is a good topic. I'm writing that one down. And that will be a video that I can add to this channel. All right, so what other questions do you all have, or what other needs do you have? So Karen in the bed making skill. Karen, what is going on with you in the bed making skill? What do you find so hard about it? All right, and then Richard, I tagged the City and Guilds website for you, so you can go in and look at that website, so you can get more information about whatever exam you're preparing for. So sometimes it is, if you're having a hard time hearing the manual blood pressure, it could be because of the way that you're holding your stethoscope, or it could be because of the quality of your stethoscope. So let me find that other video where I give you some extra pointers on, here it is here. All right, so I need to do a new video on blood pressures. Thank you all for letting me know. But Karen, this one is for you, and I think it was also Richard who asked about blood pressure. So now I've just posted 2 videos about blood pressure. They use too much sheets, so so for the state of Florida examination, we only have 3 linens. That's the top sheet, the bottom sheet, and the pillowcase. And every facility has a different set of standards. So if they're using too many sheets, maybe is it the draw sheet that they're using that you're having a hard time with? Because the fitted sheet should be relatively easy. And Karen, what city are you in, or what state or country? And I'm doing my research as I'm talking to you all. And I have so many videos. So Karen, this is the bed making video. It's older, but hopefully that will help. And if it doesn't help, just shoot me an email and let me know specifically what you need. And I have mannequins, I have interns, and I have beds. I can redo that video relatively quickly. Is anyone interested in becoming a business owner? I really need for you all to be thinking about entrepreneurship and how you can change or take your passion for healthcare and open up a business. Because right now, if you're just 20, you don't think about the fact that you're going to age out and you're going to be tired of being at the bedside. So, I want you to be thinking about that. I want to be planting those seeds so that in the future you can really be thinking about what else can you do to generate some extra income. In Jelson, it says, good May friend. All right, so they don't use a fitted sheet. That is odd. So if they're not using a fitted sheet, I don't understand what they're doing. All right, so we talked about the different skills you all need help with. So you need skills such as blood pressure and also making an occupied bed. Anyone else? Because this is going to help me determine our next videos, our videos for this week, actually. And then we have communicating with a dementia patient. So Bo's good question, and I apologize if I misspelled your name or mispronounced your name. So Bo's question is, which is better for accuracy measuring of blood pressure, the manual or the electronic? The manual is more accurate. However, we do understand that if a person's blood pressure is low, or if the person who is obtaining the blood pressure, if they're not good at performing the task and they just make up numbers, that's not good also. So usually my recommendation is that because some facilities do not allow the CNAs or the PCTs to do the first set of vital signs. The first set of vital signs must be done by the nurse for that shift to get a baseline. So if you're at a facility where that's not the requirement, if you have tried to get an electronic or automatic blood pressure on the patient twice, and the number is, concerning to you, that's when you would go and tell the nurse, and that nurse should come in and do a manual blood pressure. And so, yes, accuracy is the manual blood pressure, but for consistency and ease of use, we use the automated blood pressure cuffs. All right, so Jacob says medical lab tech questions. Now, Jacob, I'm a nurse and I'm not in the lab. So are you talking about like phlebotomy as far as like orders of draw? So what would be a topic that a medical lab tech would need assistance with? And I can start doing that research too. And whoever gave me the heart, thank you. Making sure I didn't miss any other questions. And trying to see what additional questions I can ask you all. So besides the CNA certification and then one student doing the City and Guilds exam, what other certifications are you all interested in? You're welcome, Bose. And then Hopi, I am studying, am doing some study on your channel to help pass my CNA, but I need a little more help. Hopi, where are you taking your test? Is it in the US or is it in a different country? Because that matters, because sometimes there could be a language barrier that I'm not aware of, and that will make answering the questions a little harder, especially if you're coming from another country and you're in the US, because our test here is, standard. It's usually only given in English. So we do have written test questions that you can print if that's going to help you, and that's on our website. And I'm going to put it in here on the chat. It's fltraining.com. because videos help, but if you just need medical terminology, you have to know your terms. If you don't understand terminology, you're not going to answer the questions correctly. So I recommend we have medical terminology videos on our YouTube channel. You study medical terminology first, and then go to our channel and download those free practice CNA exam questions. All right, and I just put that in the chart in the chat area. Yeah, so the New York exam should be pretty similar to the Florida exam. So did I answer your question, Hopi? Oh, I am blessed. That is so awesome. So child care specialist certification. So how are you going to marry the two? How are you going to marry CNA? You're studying over here, you're learning all this medical stuff, and then child care specialist certification. Are you going to be taking care of children with special needs? Like, what's your hope for the future? And I wish there was a way I could talk to you all live. I don't understand how to do that yet. Maybe one of you all will be able to tell me. And then that way we can have you on live instead of us being in the chat. I can actually answer your questions, and have you talking. And then Karen, so proud of you for doing the practical nursing program. Are you already in the program, or are you just now applying? Yes, so Hopi, those medical terminology, let me find the video for you on medical terminology. I know I have it on my channel. But yes, study medical terminology. And on our website, if you don't have a medical terminology book, we have a medical terminology bundle. It's only $5. But of course, you can start with free resources first, such as this video that I'm going to be sending to you. And study medical terminology. Anytime you don't know a word, I need you to look it up. All right, and so let me give this video to you so you can understand terminology. And then when you practice your questions, if there's a word you don't understand, you have to look it up. If you don't look it up, you're going to continue to answer questions incorrectly. All right, that is for you, Hopi. Let's see if I missed anything else. Karen, your exam's in November. You're almost a nurse. I am so proud of you. So proud of you. Yep. So by the time you're finishing, we'll have our NCLEX prep classes, our videos up, and then maybe I can reach back and hire you to help me co-teach some of these classes because it's a lot of classes to teach. All right. So if you all don't have any additional questions, I'll be leaving in about 5 minutes. So what's one thing more that you'd like to learn in healthcare? So Karen's going to be finishing up her LPN in November. So probably the next step for her is going to be IV certification. I do have the mannequins. I have the equipment. I've just not made the videos on IV certs. So that'll be something you can be considering in your state, Karen. But for those others who are on the chat, what additional skills, certifications, or information would you like for me to share? Oh, you're so welcome, Hopi. I know you're going to do it. We're all saluting you. We're going to do it together. You all, we need good healthcare providers. We need people like you. So you all are the next group of aspiring healthcare leaders. And so anything that I could do to help you accomplish that, I am going to do it, including making videos, partnering. I need for you all to get these certifications, to know what you're doing so that I can invite you back on here to help me co-teach. I need some additional instructors. Well, all right. There are no more questions coming through. Oh, here's a question. I have a healthcare assistant diploma. Also, I have my license in BLS and first aid, CPR, AED. What other certifications do I need again, though in Nigeria, but trying to move to the US? Well, I've trained multiple caregivers from Nigeria who end up either going to Europe or they go to Canada. Oddly enough, they'll go to Canada. And so I don't know how hard it's going to be for you to get your CNA while you're in Nigeria, but something else to consider since you already have BLS and first aid is to become a BLS instructor, become a CPR instructor, because that's pretty much transferable wherever you go. If it's based off the American Heart Association protocol, the CPR is going to be CPR. The way you perform it in Nigeria is the same way you're going to perform it in Canada. As long as, if you know what country you're moving to next, I would be researching what certifications would be able to be carried over to that other country. So that would be where I would start. And if you need, I don't, if you let me know where you're going to, if you're going to Canada, I can definitely connect you with one of the Nigerian physicians I know who left Nigeria and went over to Canada. All right, so you are white. I wish there were a way to speak. I know. One day, I don't understand why they won't let us speak through this, but maybe there's a technology I can research that. All right, so guess what, everybody? If you all don't have any other questions, I'm going to thank you all for being on the live tonight. So Kelly says disease specific. So you want a breakdown of different diseases, such as diabetes, hypertension. Do you want it all to focus on adults, or do you want adults and pediatric diseases? And I think that is a great ideal. I love you all. You're going to keep me busy, but hey, that's good. And Kelly says, yes, so we want adult and pediatric illnesses that we'll be discussing on this channel. Well, you all, you know that I love you. I thank you for taking like 30 minutes of your day to spend time with me, to ask me questions. And I'm not rushing you. I just don't see more questions coming through, and I want to be mindful of your time. So if you don't have any more questions or comments, I will see you on the next video. So bye, everybody. Have a good night.